Peace and greetings to you. This is Omar Abdul-Malik, physician assistant and health educator. As many of you all may know, I work as a hospitalist PA. I wanted to answer a question that was posed to me by somebody in the comments section, I think it was last week, and that was about how to establish a good patient rapport with patients when they're upset. And it's interesting because I had a patient today that was really disgruntled to the point of being very abrasive with the staff. And he and I had established a pretty good rapport. And the way I did it is I kind of identified fairly early on in our initial meeting that there were some issues with which this patient was dealing, some emotional and possibly psychological issues. So when I interacted with him, I would be, or I should say him/her, I would try to be very calm and keep my voice down. Hey, how you doing? And not raise my voice, not really respond to the patient's aggressiveness or abrasiveness. Because if you kind of go there with your patients, they're angry because they're sick or they're in pain or they're in unfamiliar environments. They start, getting loud, and then you start getting loud in response to their loudness. Then they get louder, and then you get louder. That's not often helpful to the situation. So I find being very calm yet firm with a patient helps. To say, look, these are the rules and regulations to which you must adhere whilst a patient in this hospital. You're free to leave. Patients can leave AMA or against medical advice, but that the onus then falls on the patient. But trying to keep myself calm. And then one of the things I also do, if you've seen a lot of pictures, you'll see the doctor kind of looming over the patient, like standing over the patient bed or, standing over the patient's chair. So, it kind of, it sets up this relationship where you're almost like the patient's parent, or the patient may feel powerless. So I try to sit next to the patient's bed, or kind of squat down if the patient's sitting in a chair, and then talk to them. And I do this with family members too, especially family members that may be very irascible or excitable. You just try to calm them down a bit. It's not always an easy thing to do, but I find for me, getting upset with the patient or the patient's family doesn't really help matters much. So I hope that answered the question about how to interact with or establish a good rapport with patients and the patient's family members. Take care. If you're interested in becoming a physician assistant or a health educator, please subscribe to my channel. Wish you all the best of success in your endeavors. Take care. Peace.